Well, I would have loved if we would have started the podcast with you asking if that ocean makes you look fat. And no, it doesn't. All right. So, hey, everybody, welcome to the Health Babes podcast. I'm Dr. Becky Campbell with my co-host, Dr. Crystal Hone. Hello. And today we have Dr. Darin Ingels, who's a licensed naturopathic physician, author, and an international speaker and leading authority on Lyme disease. So he is a former Lyme patient who overcame his own 3-year battle with Lyme disease after having failed conventional treatment and became progressively debilitated. Dr. Ingels found that proper diet, lifestyle management, and natural therapies worked with his body to heal instead of against it. So then he applied what he learned about his own healing journey to his own Lyme patients and found they recovered faster with less side effects. Dr. Ingels has now treated more than 7,000 Lyme patients using this novel approach, many who have gone on to live healthy, symptom-free lives. He is also the author of this awesome book, The Lyme Solution, which I've read, and it's very, very good. So welcome.
Oh, well, thank you so much, Becky and Crystal, for having me on the podcast.
Yes.
You're welcome.
So why don't we start off with what is Lyme disease and how does one get it?
Well, Lyme disease, very simply, it's a bacterial infection. And most people acquire it through a tick bite, and a very specific kind of tick. It's the deer tick. You know, there's a lot of different ticks out there. I mean, I've lived all over the country, and I can remember when I lived in Kentucky, my brother and I go hiking through the woods and the creek, and we'd come back covered in these ticks. And a lot of those ticks were actually dog ticks or wood ticks. And as far as we know, Lyme isn't really transmitted through those kind of ticks. But these deer ticks, you know, they're little teeny weeny tiny things. They're about the size of a poppy seed. Mm-hmm. So they're really hard for people to pick up if they've been bitten by one of these ticks, but these are really the primary vectors in which people acquire Lyme disease. So if you live in an area that's endemic for Lyme, which is the Pacific, the Northeast, you know, New England, the Central Midwest, these areas have a lot of these deer ticks, although we're finding that these ticks have migrated away from those areas, and it's really now up and down the East Coast and the West Coast. Lyme's been reported in every state in the United States, so there's really nowhere that's impervious from being exposed to these ticks, but there are areas that have higher concentrations. So if you get bit by this tick, it basically injects its saliva in you, and in that saliva contains this bacteria. And the Lyme bacteria is a little bit unusual because it's what's called a spirochete, and a spirochete are these corkscrew-shaped organisms. So most bacteria look like little balls or rods. This one's kind of a long corkscrew. And that shape actually gives it the ability to penetrate into your cells, to get into really any tissue in the body. So when people get Lyme disease or when they get infected by this bacteria, we can see a lot of different manifestations of symptoms. So it's just one of these things that can be really difficult to diagnose, can be really difficult to pick up on. And again, unfortunately for a lot of people who get bit by a tick, you know, they don't recognize they got bit by a tick, and it may take a long time before they actually get diagnosed.
I think that people think if they don't have a bullseye rash that they didn't get bit by a tick. You know, Crystal and I went to school together in Atlanta, and I used to run this mountain. Did you run at Kennesaw Mountain too, Crystal? Mm-hmm. And I would get these little tiny things on my legs. And I remember trying to get them off my legs. They were little bugs and they would make me bleed. And I will now, like, looking back, I'm like, gosh, how many tick bites did I have? And I didn't know, you know?
Mm-hmm. Yeah.
Yeah, and it's really interesting because, you know, even the World Health Organization came out with a paper a few years back showing that, you know, the increase in insect-borne disease. So it's not even just ticks and mosquitoes and fleas. You know, climate change has really driven a lot of that. You know, that's part of why we're seeing these ticks migrate away from their areas, because they get on birds, and birds are now flying further away when they migrate than they did before. So, you know, the tick hops on the bird goes somewhere, you know, hundreds of miles away, lands, that tick jumps off and starts a new colony of ticks. And there was one study that found that, you know, even ticks in the US can go as high as the Yukon, you know, that's way up in northern Canada. So we know that there's that capacity to, you know, these ticks to get elsewhere around the country. And again, this isn't just a US problem or North America problem. We're finding, you know, Lyme disease is really throughout the world. You know, they've got, you know, cases in Europe and Asia. The only place that they haven't reported is Australia. Australia says we have no ticks in Australia. And I guess the ticks can't swim that far. So
Interesting.
yeah, I've had quite a few Australian patients I treat that have, classic symptoms. They do test CDC positive. So I don't know, go figure.
Wow. What are some of the symptoms of Lyme disease? Like the most common, I guess. I know there's tons of them.
Well, the most common one, so you mentioned that bullseye rash. So the bullseye rash is a hallmark of Lyme disease. And when people get that, it's kind of a, do not pass go, do not collect $200. You have Lyme.
Yeah.
It's what we call pathognomonic. It means it's the only thing we know that creates that specific kind of rash. And for those of you who don't know, we call it bullseye rash because it looks like a bullseye or a target. It's these sort of concentric rings of, red, clear, red, clear. And what makes it kind of unusual too is that it gets a flat rash. So a lot of rashes that people get, they're raised, they're itchy. This one doesn't tend to be itchy. It's flat and it spreads. When I got bit, back in 2002, I got bit on the back of my leg and I couldn't see it. It started about the size of maybe about the size of a large quarter. And by the time it got done, I measured it. It was almost 18 inches in diameter. And it spread over the course of 6 weeks. So again, it's kind of unusual that a rash will keep spreading. So that flat spreading rash is always very dubious that it might be a Lyme rash. And sometimes these Lyme rashes don't look like a target specifically, but flat spreading rashes would make me very concerned about that. The other symptoms we see are the typical symptoms when you get sick. You can get fever and chills and swollen glands and fatigue and joint pain and neuropathy, which is like numbness and tingling in your hands and feet. And sometimes people even get Bell's palsy, where one side of your face starts to droop. But, if you look at the symptoms of Lyme, there's over 100 different symptoms associated with Lyme disease. And I sort of break it down to, acute Lyme disease, where people are acutely sick. This is may what bring them to the doctor or even the urgent care center or the hospital. And that's, again, that fever. I had 105 fever when I had Lyme. So a lot of people get very high fever because bacterial infections can tend to do that more than viral infections. And you just feel acutely sick. But when it becomes more chronic, if you didn't get that early diagnosis and if you didn't even really get those acute symptoms, you just might start noticing you're having different neurological problems. People start complaining of like memory loss, brain fog, sleep disturbances. They feel clumsy. They start tripping over their feet or dropping things. The neuropathy can spread and affect, more areas of your body. Confusion. People can't, sometimes they're driving, they forget where they were going, or they'll see someone they've known for a long time and forget their name. So when I see this combination of neurological and arthritic symptoms, that really narrows the field down. There really aren't too many other conditions that cause that. We're talking about Lyme disease today, but I guess I should qualify that a lot of these ticks that carry Lyme do carry other infectious agents that can cause very similar symptoms. So things like, Bartonella and Babesia and Anaplasma. I swear every time I go to a Lyme conference, there's like more things we're adding to the list that can cause these kind of symptoms. So I guess we should say, tick-borne illness collectively is what we're really referring to, with Lyme sort of being the poster child of that. So as we're doing our evaluation, we're not always just, testing for Lyme. We're usually testing for these litany of other infections that can cause similar symptoms. But again, the fact that Lyme can invade so many different tissues, that's why we can see so many different symptoms. So for most people, it's arthritic or neurologic, but sometimes it's gut issues, and sometimes it's respiratory issues, and sometimes it's skin rashes. So, we just kind of have to look collectively at the totality of all these symptoms, because at the end of the day, Lyme really is a clinical diagnosis. And I'm sure we'll talk a little bit more about that in a minute, but it's that combination again of arthritic and neurological things. That's a big red flag for me that we should investigate Lyme.
Yeah. How is it diagnosed?
Yeah, so from a conventional standpoint, there's a two-tier testing. So the first test is an antibody test. It's a blood test, and it's a Lyme screen. It's a combination of IgG and IgM antibodies. And if that test is positive, then it flexes over to a more specific test called a Lyme Western blot. And the Western blot actually looks at a series of antibodies against the Lyme organism. So, conventional wisdom would tell you this is a great test, right? We do a screen first, pick that up, and then we do that more specific test, and that's going to tell us for sure that yes, you have Lyme disease. Well, again, I was a med tech before I was a doctor. I used to do this test for a living, and when you look at the research on this test, the sensitivity of the test is very poor. And a good lab test for any lab test, no matter what you do, should be at least 95% sensitive and specific. So if you have the condition, it picks it up. And if you have a positive test, it's really confirming that you have that condition. Well, when you look at the Lyme screen, the sensitivity is somewhere between 43 and 46%. So it literally misses more than 50% of people that have Lyme disease. That's a terrible test. And the 40 years that we've really identified Lyme, we've never really changed that criteria. We've never found better ways to try and evaluate Lyme. So it's really interesting. If you go to the CDC's website and you read about Lyme disease, it'll even tell you on their website, Lyme is a clinical diagnosis. And what that means, it's based on your signs and symptoms, not just on the lab report. So what they'll tell you is that's based on signs and symptoms, particularly if you live in an area that's endemic for Lyme. And the lab test is really kind of confirming your suspicion. So what I often see in my practice is that people have these clinical symptoms of Lyme. They've been to multiple doctors and specialists. They get all these other blood tests that look completely normal, and no one's really investigated that Lyme piece. Or maybe they did, and maybe they ran a Lyme test through Quest or LabCorp in one of the big reference labs, and it came back negative. And the doctor says, well, you don't have Lyme disease. Well, again, for someone who used to work in the field, I can tell you that, false negatives are pretty common. False positives are actually very uncommon. So if you're lucky enough to get a positive test, you kind of know, and that just confirms, what you've been, feeling. But if you have a negative test, it doesn't exclude the possibility of having Lyme. And I think, we in the Lyme world as practitioners, this is where sometimes we run into this really gray area, because we're battling the infectious disease doctors about, does someone have Lyme disease? And a lot of them are in the camp of, if you don't have a CDC positive test, you don't have it. And the research doesn't corroborate that at all. And I go into a lot of details in my book with the actual references about why the testing really fails. And if you think about it too, it's an antibody test. Well, antibodies are influenced by a lot of other things. What if your immune system doesn't really recognize Lyme as being a pathogen? What if you've got some element of immune deficiency? What if your exposure happened months or even years ago? We know that immunity naturally wanes with time. So the fact that we're still using antibodies as a measurement of exposure, we just have so many external factors that influence antibody production. So, without taking all that into consideration, it'd be very easy to dismiss that, oh yeah, you don't have Lyme and, it's something else. But, we have to kind of look through that and see, do people really have the clinical features of Lyme? In our due diligence, we have to exclude other possibilities, because Lyme does look like a lot of other things. And we call Lyme the great mimic or the great imitator for that very reason. It looks like mono. It looks like autoimmune disease. It looks like lupus and rheumatoid arthritis and MS, and it goes on and on and on. So, we have to go through the process of doing other lab tests, sometimes imaging studies, to rule out these other possibilities, just to make sure we're really on the right track. But, it's just one of these things that's become such a gray area in medicine about getting the proper diagnosis. And what's really interesting too, when you look at the antibodies, we've learned over the years of research that some of the antibodies that are made are very specific to Lyme disease and other antibodies aren't. So why haven't we just tailored it down to, let's just look at those Lyme-specific antibodies and kind of ignore the non-specific ones? And so, the CDC's guidelines is you have to have 2 out of 3 IgM antibodies or 5 out of 10 IgG antibodies on that Western blot test to call it positive. Well, what if you only have 1 instead of 2 IgM antibodies, but it's a Lyme-specific antibody? And the same with the IgG. If it's specific to Lyme, which means as far as we know, there's no other infection that causes that antibody production, it's like being a little pregnant, right? I mean, you are or you aren't. So if you've got Lyme-specific antibodies, isn't that significant, particularly when you've got the clinical symptoms and you've ruled out these other possibilities? So, I mean, look, when I was in med school, if it walks like a duck and quacks like a duck, it's probably a duck. And the same thing in the Lyme world. It's like, if you've got Lyme-specific antibodies and you have clinical symptoms and you've ruled out other possibilities, we kind of come to the conclusion that, you probably have Lyme disease.
That's a really good analogy. You're kind of pregnant. What's the typical treatment for Lyme disease?
Well, in the conventional world, I mean, it's antibiotics. And
Right.
what's really interesting too is that, it used to be 2 to 3 weeks of antibiotics. The IDSA, the Infectious Disease Society of America, who really writes the guidelines for the CDC, has revamped that. I think now they're recommending only like 10 to 14 days. So they've shortened the course even more. And what's crazy about that if you think about it, if you've got like a sinus infection or bronchitis, you go to your doctor, they give you a course of antibiotics. Maybe it's a week, 10 days, 2 weeks tops. And then you get through the infection and you're fine. Well, if you get exposed to tuberculosis, they're going to put you on a triple antibiotic cocktail for up to a year. Why is it so different? Well, tuberculosis is an extremely slow growing organism. And if you consider most bacteria in your body replicate every 10 to 15 minutes, tuberculosis is every 15 to 20 hours. So that's considerably slower. And most antibiotics work best when these bacteria are in a replication phase. But if you look at the research on Lyme disease, it replicates every 1 to 16 days, not hours.
Wow.
So why are we content to give someone antibiotics for, a week and a half to 2 weeks for an organism that's more slow growing than tuberculosis?
Wow.
It just makes no biological sense. But that's sort of the conventional approach. Occasionally you can get a doctor that might give you antibiotics for a month. But I think most of us, again, in the Lyme world, agree for acute Lyme disease, it's too short. You need a longer course to really ensure that you've gone through enough life cycles of the organism to help eradicate it. So I think if you're using antibiotics, 6 weeks is the minimum. There's a group out there called ILADS, the International Lyme and Associated Disease Society, that has completely different guidelines. And I've trained with ILADS, and I agree with them to a certain point with acute Lyme disease that longer courses of antibiotics are probably warranted. Now, in my practice, I rarely see somebody with acute Lyme disease. Almost everyone coming to me has been exposed months or years prior to. So in my world, I think we've missed that window where antibiotics are going to be as effective. So look, there's a lot of doctors out there that treat with antibiotics, nothing against them or against antibiotic therapy. It's just different. In my world, being a naturopathic doctor, herbs are really the go-to for treating any kind of infection, and particularly Lyme. And we find that there's been more and more research coming out on botanical medicine to treat Lyme disease. So Dr. Zhang at Johns Hopkins has actually published now several studies. Now, granted, these are in vitro studies, so taken for worth, but they compare these botanical extracts sometimes to doxycycline or other antibiotics that we typically use for Lyme. And really kind of across the board, we find that the botanicals outperform doxycycline. And they also treat Lyme in its different forms. Lyme has this long corkscrew shaped organism, but it can also kind of ball itself up in what's called a round body form or a cyst form. Well, we know when it goes into that balled up form that the antibiotics don't really do anything. So we've got evidence now that the herbs actually do when it goes into that form. And then Dr. Eva Shoppe at the University of New Haven has also done some in vitro work looking at different types of botanical extracts. And again, we find that these herbs actually work quite well. So we've at least got some preliminary evidence, in research labs that the herbs work. We just know clinically, again, if you look at cultures around the world that use botanical medicine as their primary medicine source, treating various kinds of infections. I mean, my gosh, we've been using, Artemisia to treat malaria in Africa and other parts of the world for decades now. And we know from the research that it works really, really well. So, the same goes for Lyme. And with botanicals, because it's not just targeting the organism, botanicals have, multiple constituents in it. So it might target Lyme, they're anti-inflammatory, they help promote better circulation, they help boost your immune system. So the beauty of it is that we can mix and match different herbs that are really tailored to the individual to find out what they specifically need to help, get their infection under control, and also to help curtail some of the effects that the infection may have had on the body. Where with antibiotics, you're really just killing the bug. And we know when, the longer you're on antibiotics, you increase the risk of, wiping out your normal gut microbiome. And we've got so much research coming out how important your gut microbiome is for maintaining a healthy immune system. Of course, it's related to diabetes and heart disease and weight management and mood. So as your gut gets more destroyed, you start increasing your risk of these other, secondary effects. We also know that long-term antibiotics have the risk of damaging your mitochondria. And the mitochondria are the part of the cell that literally create energy and facilitate, tissue repair or cell repair. So for people who are chronic fatigue, you can imagine if you're on long-term antibiotics, you're going to really struggle to get your energy back because you're constantly undermining that innate mechanism that's built in to make that system work. So with herbs, we don't have that same negative impact on the gut. We don't damage the mitochondria, and we have the ability to address, all these different aspects of what Lyme does to the body. So in my world, it's a safer, better approach. And it's not to say I never use antibiotics. I do. In all fairness, in 20 plus years of practice, I can probably count on less than two hands the number of antibiotic prescriptions I've written. But there are a few people out there that just do better with that. But again, for me, it's a hierarchy. There's a place to start. If we start with herbs, we don't feel like we're getting the kind of benefits we want, we might change protocols. But at some point, there may be a time where the antibiotic is really warranted. But again, it's about where you start and what's going to be in the best interest of each patient.
Do you find that Lyme can usually contribute to other autoimmune problems? Do you see a lot of that connection? Yeah.
Absolutely. And, if you really kind of geek out on this kind of stuff, just go on to what's called PubMed. This is the big national database of where pretty much all research is published. Type in any condition. It could be multiple sclerosis, ankylosing spondylitis, migraines, whatever it is. And then capital letters put and. What that does, it links your terms together, and put molecular mimicry. Molecular mimicry is the immunological mechanism by which it creates autoimmune problems. And we've got a pile of research on how various microbes can cause autoimmune disease. With Lyme very specifically, we've got evidence that it can target, in the immune system's response to the organism, it can target the white matter of your brain. It can target your peripheral nerves. It can target your joints. So how much of the symptoms that people experience are the infection versus how much of it might be this autoimmune reaction that gets triggered? And I think when it's just the infection, you go on treatment, those symptoms go away actually pretty quickly. When you've been on treatment for a while and the symptoms aren't really getting a lot better, for me, that may be evidence that it may not be the infection by itself that's causing the problem, but really more of this autoimmune issue. And that's what I discovered in my own healing process of getting over Lyme, is that it isn't really just about killing the bug. The bug creates this swath of destruction, and now you got to clean up that mess. And because so much of that mess is in the immune system, we have to rebalance the immune system. We have to get it under better control, because I think at some point the immune system starts to treat Lyme like an allergen instead of a pathogen. So it's a different part of the immune system that's engaged. It doesn't necessarily impact your ability to fight infection. In fact, most of my Lyme patients, they don't get sick any more than the average person. It's not like they're necessarily truly immune compromised, but this other part of your immune system is now turned on. And that's the part that creates autoimmune issues. So, we've seen that Lyme is associated with something like MS. That's what happened to me. I had Lyme in 2002. I really got better 2005, early 2006, went years of being symptom-free. And then over a decade later, I developed MS. And knowing that there's that association, it kind of makes a lot of sense. And the symptoms of MS look a lot like Lyme disease. You get the neuropathy, you get muscle weakness, you get brain fog, you get tired. All these things is all the same kind of symptoms. And when I first started having symptoms, I'm like, oh, this is just a relapse of Lyme. And I went back and treated Lyme, and it didn't really get any better. And then, once I finally got imaging studies and the spinal tap and all that, it's like, oh, well, yeah, it's something different now. And again, we see this happen with people that have been diagnosed with rheumatoid arthritis and lupus and polymyalgia rheumatica. Look at the symptoms. There's so much clinical overlap. And what's interesting for these diseases that are kind of descriptions, fibromyalgia, chronic fatigue syndrome. What's that? It's just a label of a bunch of symptoms. And if you ask the specialist, well, why do I have this thing? Oh, I don't know. It's just the way you are. Well, is it possible that Lyme or some other infectious agent is at the root of that condition? And it probably isn't the same for everybody. But, again, when you look at the literature, we know that infectious agents do have the capacity to trigger these autoimmune conditions. I find Lyme in particular is a very common one. But, with MS specifically, we know that Lyme can cause it. We know that Epstein-Barr virus can cause it. We know that human herpes 6 can cause it. We've got evidence of that. So I think as practitioners, we're always trying to look at root cause, illness. And when someone has any kind of autoimmune problem, it's at least worth doing that detective work to see, is there an underlying infectious agent that might be the trigger? Because again, it might take you down a bit of a different treatment path. So I think, there's a bit of medical laziness when it comes to autoimmune diseases, because, the rheumatologist or the PMR specialist might just say, okay, well, yeah, here's your label. And then here's your steroids, here's your disease modifying drugs, here's all these horrible things that are probably going to have a lot of side effects, versus, digging deeper and really trying to understand what triggers it. But I think as functional medicine practitioners, this is our forte, that, we have the mindset that we want to dig a little bit deeper. We want to try and find that root cause. And in some cases, it's as simple as blood work. You can do blood tests for a lot of these infectious agents. And sometimes it's through stool testing. Sometimes it's through organic acid testing. So we have a lot of tools in our chest that we can use to try and help identify where those triggers might be coming from.
So why don't you talk, I know you have a really cool course out. So why don't you tell us about that and tell us how to find that?
So I have a course that's not out yet. We've been working on it for a while now.
Well, you and I have been talking about it for a long time. So I know it's
coming out been
soon.
In the works. Yeah, I'm really excited. We've got a course that we're going to be launching this summer. I think right now our target is August.
Okay.
It's going to be an overcoming chronic illness masterclass. And what's really cool about it is that it's going to have a ton of information. And the best part, it's going to be completely free. So we love giving out free stuff to people. All you're going to have to do is, just sign up for it, engage. It's going to run for a week. So we're going to give you so much information about, what is it that makes people sick? What is it that keeps people sick? So we're going to go into a really deep dive about, root cause illness. And we're going to talk about a lot of things you can do that you don't need to necessarily depend on your doctor to do for you. How do you take, action in your own life with your diet and your exercise regimen and your sleep pattern and the kind of things that you take in terms of supplements and herbs. So we'll go into all the details of that about, really helping understand you, your body. And for someone who's, had these like ongoing nagging symptoms that you just can't seem to shake and no one can really figure out why, I'm hoping that we can start pointing people in the right direction to figure out those root causes. And I'm also hoping that people are working with, functional medicine practitioner to help give them that hand holding. But we want to empower people to really start taking charge of their own health and not necessarily rely on their doctor to do it for them.
Amen.
That is so great. That is awesome.
Yeah,
Well,
so we'd love for people to, to join us on our mailing list. If they go to my website, they can just sign up. And as soon as we have those hard dates and we're ready to launch the course, we'll definitely let everybody know. But I know that we're shooting for early August right now.
And we'll put your website in the show notes for everybody. And where else can everyone find you?
All over social media. So my handle for all social media is pretty much at Darin Ingels ND on Facebook and Twitter and Instagram and YouTube. So again, we'd love for people to follow us. And I think we have a lot of great information to share with your folks.
You really do. And definitely get on his list, because if that course is free, you all want that course, trust me. So you want to know when it comes out. So we will definitely put a link to get, everybody to be ready and waiting for that course to come out. And I can tell you, I've worked with Dr. Ingels with some family members, and he's amazing. So you have to follow him. And thank you so much for coming on and sharing your knowledge with us.
Yes.
We love you and we love your book and we just love everything, why we watch all your interviews and everything. Mm-hmm. So thank you so much.
Yes.
All right. Thank you guys so much. I really appreciate it.
Yes. Have a great day.
You too.
Thanks for listening, everybody.
Yep.